Hi, everyone. Welcome to the information session about the merger of DirectTrust and EHNAC. We're really excited for you to join us today and to learn more about our plans for 2023 and beyond and what's upcoming. So just a couple of housekeeping things at the beginning. Scott, if you can take me to the next slide. As typical with DirectTrust meetings, we start off with our antitrust statement. It's the policy of DirectTrust.org Inc. to conduct its operations in strict compliance with the antitrust laws of the United States and the DirectTrust antitrust compliance policy and guidelines posted on our website. Violations are grounds for discipline by or dismissal from DirectTrust as an officer, director, employee, or member. And for those of you who are joining us today who are not members, which I believe is the majority of you, DirectTrust maintains the uncompromising position of compliance with the antitrust laws of the United States. Regardless of DirectTrust membership status, your participation in this meeting indicates your agreement to engage in personal and professional conduct conforming with these laws. So as a general overview for today with the agenda, we're going to walk through some background information regarding the merger. We've received a lot of questions, and we're excited to share this background information with you about how each of the organizations will be impacted, how accreditations will be impacted. And then, of course, the questions that we're getting are mostly about the future and the opportunities. So specifically, we want to talk about opportunities with identity and moving forward in that space, as well as TEFCA. And of course, your questions are extremely important. So we do have time at the end to address your questions. So before we dive in, just some other housekeeping things. We are in a webinar format, so attendees are muted. You are more than welcome to enter your questions into the questions panel and go to webinar. Kelly and I will be monitoring those and answering those as we can. But again, we'll also have time for Q&A with Scott and Lee at the end. They will not be monitoring the questions or chat as we are presenting today. You're also more than welcome to use the chat function. The chat function does go out to the entire audience if you put information in there. So with that, we are ready to begin. So Scott, I will pass the mic over to you.
Sorry, I'm muted. So thanks very much for joining us. So as Catherine was kind enough to share, EHNAC is merging with and into DirectTrust. I'm sure that that's the reason that you all are here. So we're excited to share with you some more details about what this means. So Lee, I want to kind of call on you first. So my name is Scott Stewie. I'm the president CEO of DirectTrust. Lee Barrett is the CEO of EHNAC. And maybe, Lee, you could describe a little bit why you believe the merger makes sense from a similarities between the organization's point of view.
Thank you, Scott, and welcome everybody. Glad to have you all joining today. So, you know, as we're looking at this merger, there's a tremendous number of synergies and really complementary areas between our two organizations. So first of all, we're both 501c6 nonprofit entities, and that's a very important consideration. So we're both really all about trying to promulgate really the mission and vision of each of our organizations in as a nonprofit entity. We're also, you know, as many of you may know, DirectTrust has its focus is around identity, authentication. EHNAC's focus is around privacy, security, cybersecurity, cyber hygiene. And so when you start to look at kind of what we're doing, it's really overall focused around trust. And, you know, in fact, our tagline is trust is everything. We've had that tagline for and used that for several years. So we feel very strongly in leveraging those frameworks. Our accreditation models, you know, there's the health information service providers, certificate authority, registration authorities for DirectTrust. We have over 20 plus accreditation programs, have been in this for 27 years. Both of us are focused around accreditation as well. So again, another synergy. We're also focused around standards. We're federally recognized as a standards development organization. DirectTrust is a standards development organization for the direct protocol. So we've both been, again, focused on transparency and openness around standards development as well. And we're both very involved in the industry from a collaborative perspective, working with a variety of different organizations as we have. DirectTrust has a lot of entities that there's some overlap between us, but then there's complementary in relation to what we're doing and what DirectTrust is doing. That's where kind of the real value proposition is that we're seeing. So these are some of the key similarities that we've been focusing on as we've gone down, and we're going down this process with the merger with DirectTrust. So Scott, back to you. Scott, you got us on mute.
Well, thank you, Jiminy. So expanding on this notion of trust. So trust is absolutely everything in healthcare and health IT. As Lee says, this is the EHNAC mission. The mission statement of DirectTrust, our tagline has actually been to be described as instilling trust in healthcare exchange. So joining forces actually gives us kind of some unique capabilities. So if we pair the privacy and security core competencies with this notion of technical trust that DirectTrust focuses on, I think, frankly, this gives us some very unique possibilities. I think to strengthen the programs that are part of the EHNAC space, as well as to create new programs that are uniquely tuned to the problem of managing authentication and authorization and technical trust in a network ecosystem. So putting those two things together, we're in a position to be able to create new accreditations that don't exist today, frankly, in the marketplace at all, focused on healthcare. So we're excited about that opportunity. We think this is a huge opportunity for us. Now, in terms of whether or not this changes anything, I like to think of, DirectTrust's mission not changing at all. So we have basically been in the process of generalizing our focus on trust, moving from a single modality focus, which is focus on direct secure messaging, to a broader focus on more modalities and technical trust in that broader arena. But also we've been focused on also the notion of expanding the notion of policy development for that same space. So having the ability to generalize our accreditation process across all of the stakeholders that EHNAC has represented, I think that's a huge opportunity for the merged organization. And so if you look at DirectTrust in terms of all the things that it does, we're still going to do all four of these things. And frankly, we've been doing the accreditation, as Lee mentioned, of our three, the three classes of organizations that are a part of our trust framework today. The notion of the health information service provider that supports direct secure messaging, and the certificate authorities and registration authorities that make technical trust work in that realm. So we're going to continue to do that, those accreditations, but in addition, all of those will actually be folded into the accreditation model that EHNAC represents. So our membership capabilities remain, our standards focus. So we are an ANSI accredited standards development organization focused not just on direct secure messaging, but on things that are related to direct secure messaging and identity. And also we support trust services of a variety of natures. So we can, I think, get a good sense of what this looks like by looking at maybe our governance picture. So the way this is going to look when these two organizations become one is that the DirectTrust Board of Directors remains responsible for the entire breadth of what it is we do. But there are three broad topics. So there are community topics, there are accreditation matters, and there are the services that we provide. And so the community offerings remain the same. So DirectTrust is not going to undo the committees and task forces and work groups we have today at our membership activities. We're not going to change what we do in the standards development space. In fact, I expect that this will probably provide us additional capabilities, and that our standards development activities inside of our ANSI accredited effort may contain new things that in the past might not have seemed to make any sense for DirectTrust to go work on, but now can. Likewise, on the community activities side, there are things that we do that involve members and non-members that we use roundtables and a variety of other structures to take place, to have those take place in. So those will continue to happen. But the accreditation that we have been doing will all be folded under the EHNAC Commission. So the EHNAC Commission will remain a function. I'll leave it to Lee in a second to describe kind of how the Criteria Council feeds into the EHNAC Commission. But in addition to the commissioners and their work and the EHNAC Commission, there are these services that as DirectTrust provide today: certificate issuance in support of both care quality and e-health exchange, and just recently expanded to the scope of TEFCA. Also, we provide a directory, which we are expanding the scope of in support of a broader scale as well. And in addition, as a part of the EHNAC merger, there comes in a high trust consulting capability, which we will manage as one of those services that DirectTrust is a part of. So the EHNAC Commission, however, is a bit of a special animal. I would ask Lee to describe a little bit how the Criteria Council feeds into the Accreditation Commission.
So the commission, as Scott mentioned, basically the process that we've always used and will continue to do so is really very transparent, open, and we follow as a standards development organization the process of providing, for example, for any of our existing programs where we're making enhancements as part of our annual release or new program development. We go through a 60-day public comment period, again, soliciting input from the healthcare ecosystem, along with the fact that we also have this open for other people, any people within the healthcare information technology realm, to be involved in our criteria process as well, to bring their requirements. So what's going to happen, the commission basically does have oversight in relation to approving all of these programs to go out for public comment and provide additional input. The Criteria Council will continue. It's been the Criteria Committee. Some of you may have already participated on our Criteria Committee. We appreciate that, and hopefully you'll continue. And we're providing a kind of open invitation for others as well to participate on the council. And so the council does go through and has representation from a variety of different stakeholders for the 20+ programs we have. They provide input in relation to additional requirements, both business and technical requirements that we need to take into account, as well as legislative that could occur. And then they develop really any of those enhancements, and then go through a process of, again, that openness and transparency, getting input from the industry, and then basically a voting, and where that then goes to the commission for final approval. So that entire process will continue, and we really think that again, bringing that and working with DirectTrust is part of that as well, and the openness and the transparency that we've had will be very important to the industry as we continue to go forward. So that's kind of how that's all going to work with the commission and the Criteria Council. Scott?
Thanks, Lee. And so let me just underscore a couple things. So the accreditation, the Accreditation Commission, the EHNAC Commission, will be the DirectTrust accreditation body. And so that's after we get this merger concluded. That's the way to think about this, is that they will be the accreditation body under the DirectTrust organization. So the big question that a lot of folks are asking is that, well, does this change anything about my accreditation? So first, let me describe for what we're going to see in the DirectTrust side. And we've gone into this in much more depth for our accredited members, but at a high level, DirectTrust accreditations will remain valid and recognized, and at some point we will transition them into under the EHNAC model. But probably for the entirety of 23, they will remain under the DirectTrust approach until the expiration of all of the members, and so that will then transition into an EHNAC style accreditation. So both of the organizations' accreditations will remain valid and recognized. There will be no change in the way that process runs. I don't think that there's any there's too much to be concerned about here. The accreditation renewals, though, for DirectTrust will occur under that EHNAC arm of the newly expanded organization. So, Lee, any comments about this? I mean, just to leave people's minds at ease.
I think you did a good job in the overview, Scott. And I think the bottom line that people need to be aware, we're keeping this as seamless as possible on the transition, so everyone really stays the same. Really, any of the changes that are going to occur are really going to occur on kind of the back end as we're looking to integrate, between our two organizations. So that's where probably any change is going to occur. But for all of you who've gone through accreditations and are used to going through your accreditation stays the same, your renewal stays the same, all of it from the standpoint of the process that you're all familiar with stays the same. That's what we're looking to do. So again, it's only going to be on any back end, which is really where we're looking to make any real changes. And so very minimal to anybody.
Thanks, Lee. And I think we will, obviously make some changes, but when we do make changes, we'll make them incrementally, and we're going to make them in ways that frankly, we hope will be entirely invisible to anyone. Improvements that are frankly improvements that we can make in part because of the combination of the two organizations. But because we combine the two organizations, Lee and I have been talking about this from the beginning as the notion of two organizations coming together that are greater than the sum of their parts. So we've called this sort of the 1 + 1 = 4 story. And from a DirectTrust standpoint, we've been in the mode of trying to expand and generalize our capabilities across these various axes, if you will. So the notion of DirectTrust, of course, initially being an organization focused principally and actually exclusively on direct secure messaging. Today, we're actually in support of direct secure messaging as well as other modalities. So we're in support of, for example, query-based data exchange in TEFCA and in care quality and in other spaces. So we also believe we have opportunities to work across sectors. We're doing this in the DirectTrust realm, but we also believe that there are opportunities for potential new programs that reflect, the ability to test and validate policy conformance and technology conformance for sectors that are in the allied healthcare space, allied to healthcare, but not in fact healthcare at all themselves, and then also across stakeholders. And so today, like when DirectTrust's stakeholders are already kind of expanding across the ecosystem, bringing EHNAC and DirectTrust together, frankly, accelerates that process because the stakeholders that are engaged in EHNAC accreditations today are very much broader than merely the healthcare information exchange space. They cover a bunch of other areas. Lee, would you mind kind of just rattling off some of the key stakeholders that are sort of networks in their own right, but also not necessarily healthcare information exchange functionality?
So, we also, with the 20+ programs that we have, obviously we've looked at, we accredit many of the clearinghouses in the country. We have financial services organizations, banking, many of the banks, for example, are doing healthcare functions as a clearinghouse, plus they have lockbox capabilities. We're also one of 6 organizations that are authorized and designated and certified by the Drug Enforcement Agency for things like electronic prescription for controlled substance. We have 3 different programs in the whole interoperability space as well that we focused on for a variety of different stakeholders. So as Scott was indicating, we have a very broad number of stakeholders that we've developed programs for, and we've worked with those stakeholders to develop those programs, leveraging our privacy and security and cybersecurity, framework as well. And so, and as well, the relationship that we've had with HITRUST as well has been very strong, and we continue to be promoting that, and we'll be promoting that as part of this merger as well. So I think that the point that all I would end up saying in addition to what Scott is is that we both have worked in very similar areas in relation to a lot of the modalities and sectors. But when you start to look at the merger between our two organizations, we also have others that we've been working with in industry, different than that of DirectTrust, and DirectTrust the same. Merging the two organizations together just broadens out our capabilities to have that much more, hopefully, impact working with the healthcare ecosystem.
Thanks, Lee. And I think the big question, I think on a lot of folks' mind relate to how this relates to TEFCA. So certainly TEFCA is predicated on this notion of stakeholder trust. And so we both have some kind of key areas. I mentioned that DirectTrust has this experience issuing digital certificates for for use in the TEFCA ecosystem. That is, of course, the TEFCA ecosystem is just launching, so it has just kind of been established, but that will actually look very much like what we have done in the past for care quality and for that our community has done for care quality and for eHealth Exchange. So we expect that to be a big part of how we support TEFCA. But in addition, I think there's an EHNAC flavor of this. Maybe you could describe that a little bit, Lee.
Sure, Scott. So we've been working in the interoperability space for really the past 5 to 6 years. And originally, when TEFCA first came out with their first draft, we put together a coalition across the healthcare industry to develop a draft program called our Trusted Network Accreditation Program. And it's really focused on health information networks that we're going to be making application to go through and become qualified health information networks, as well as there's a whole flow down provision for that for participants and sub-participants. So we invested in developing draft about 5 years ago when that first draft did come out of TEFCA. And when TEFCA was finalized in January of this year, we finalized that program. It aligns with the common agreement, it aligns with the QHIN technical framework as well. And again, it's not, as many of you know, TEFCA is voluntary, and what they're in the process of doing is going through and putting a lot of those standard operating procedures in place, and organizations are starting to go through the process. So although TNAP that we've developed is definitely not a requirement for QHINs, again, we've partnered with HITRUST for that, and HITRUST has been selected as part of the security standard operating procedure as far as their HITRUST R2 to meet the security requirement for these entities, the QHINs that are going to go through the process. So we continue to work on this whole aspect of TEFCA, and as it's going to look to evolve and operationalize, especially in 2023, we want to continue to work with them. We've created others in relation to one called a Trusted Dynamic Registration and Authentication Accreditation Program, where we partnered with UDAP. Again, this is a construct for security and architecture around the Fire at Scale Task Force, which is very important and is now part of the HL7 Accelerator. So that's another program that we have. We have a number of channel partners there. And then we also partnered with Karen. About 6 weeks ago, we announced a program with Karen to focus on kind of the consumer side here of interoperability. So we're very pleased with that. So the point is that we're definitely very committed to interoperability. We're very committed to seeing it operationalized and to gain as much adoption in the healthcare industry as possible. And so I think with the combination merger between what DirectTrust is doing, what we're doing, we really hope to help to accelerate some of that adoption and be working together with all of the various collaboratives that we have set up with all the various organizations. So we think hopefully that'll even expand further as we look at some of the opportunities together. So back to you, Scott.
Yeah, so I think we've talked a little bit about these already, but the notion that we want to generalize our interoperability support beyond TEFCA, because certainly healthcare interoperability is not going to be limited to life inside of TEFCA. We know, for example, that direct secure messaging is outside of TEFCA. There are other kinds of healthcare information exchange that will occur outside of TEFCA. We want to generalize that support within TEFCA and outside, but also beyond direct. So direct secure messaging is still a core part of what it is DirectTrust will be involved in, but we're also focused on FHIR APIs, consumer credentials, and mechanism to ensure technical trust. And then we're going to broaden our capabilities to focus on interoperability solutions that cover the whole healthcare ecosystem. We believe that frankly that's our role as an organization that can ensure that policies are conformed with. So so consumers, we talked a little bit about this. So consumers are a huge, obviously the largest group of healthcare constituents, and they're an incredibly vulnerable group. And Lee already talked about the specific program that's come for the Karen Alliance. I think we believe that our work in this space is only beginning. So a consumer credential effort is another piece of work that we're looking at kind of driving into. And we do believe that we have a substantial role to play in this space. So really trying to make sure that as the consumer is served with a credential that's useful in lots of different contexts, that it's done so in a way that is that is secure and doesn't undermine the trust of the data holders or of the consumers. So this is, I think, a really key aspect of what it is we're working on. I'm going to go ahead and move to the milestones, and so we got plenty of time for questions for the group. But so first off, this has sort of got some stuff in the past and some stuff in the future. So we're at 12.9, that's the public information session, but we've done a number of these information sessions in advance of this discussion. So this is the last of our public information sessions, or our information sessions on the subject of the merger. But basically, the big milestones ahead of us are the actual consummation of the agreement. So we've signed the agreement, but it actually becomes closed on January 4th. And then on the 5th, we will make a public announcement that the merger is executed and complete. So that's those are the milestones ahead. But really, really appreciate you all being here to learn about what it is we're talking about. I also want to make sure you know that there is a place to go if people have missed this conversation and want to know what's going on. There's an FAQ that's at this link. And our team will drop this link in the chat as well, so that you can get to it easily. Although it's not hard to reproduce this link, but it's basically just an opportunity for you to see what sort of questions have been asked and answered already. And frankly, if there are questions today that get asked as a part of this effort that then we answer subsequently, we'll go ahead and put these out on this frequently asked questions link. So really want you all to know that this is a way you can learn, and also pass the information to others who did not have an opportunity to participate in this discussion. There will also be, after this is concluded, the recording of this meeting, as well as these slides, will be available as well publicly. So very much interested in the questions that might come from this group. So I don't know if we have any questions that have been teed up already. So Catherine and Kelly, are there questions?
There are. So just to reiterate exactly what you just said, Scott, because we did get the question several times. So yes, this information session today will be publicly available through the website, through that short link, and we will continue to update this short link with information as the merger completes and as we have additionally frequently asked questions and other resources as well. So it's a good site to bookmark and to pass along to your peers if they missed today's session. So just reiterating that, since we did get several questions about it. And then we have a great question from Emily Mata from MyHIN. And I think this question is very interesting too, because I know EHNAC has some accreditations and certifications related to payers and payment models, et cetera. and there are various users of Direct. So Emily's question is about payers specifically, and that they've been slow to adopt direct secure messaging and continue to rely on fax technology. So what new synergies do we think are possible by combining EHNAC's privacy and security simplification capabilities with the power of the direct community?
Now, this is a really great question, and it's interesting that you asked this question at this time, since another one of our kind of a community of participants, who's actually not a DirectTrust member, but an organization that has been involved in our Direct in Practice roundtable, sent me the same question this morning, basically asking, can there be policies, nationwide policies, that are reflective of the needs for people to adopt direct secure messaging for certain workflows and needs? And so the answer is there's certainly potential here. The fact of the matter is that sometimes it's difficult to instantiate policy without explicit obligation from any outside party. So I think that's while a possibility, we'll have to figure out what the best way to do that is. Lee, what are your thoughts?
I think, and Scott, I think we started talking about this as well kind of earlier in the week, as people were talking about, this issue on how we look to outreach to the payers and getting the payer community to be more actively engaged. I do think, Emily, it is a great question, and I think that Scott and I, DirectTrust, and what we're, as we look at this merger, I think this is one particular area that we want to perhaps explore a lot more, and perhaps come up with some strategies that on how we can look to engage the payer community a lot more, because we clearly both want to do that. And we may as well look to many of you as part of kind of like the industry collaboration that we have, as we look to kind of come up with some strategies here to get some feedback as we look to develop some of these. So it's a great initiative. I think we both are focused what we'd like to focus there, and getting the payers more engaged and more involved with a lot of the initiatives that we're working on. So I rest assured it's on our radar screen to focus on in 2023. So very good. Thank you.
Great. And just kind of continuing to echo the cross-sector, cross-modality conversation that Scott and Lee, you mentioned earlier, we have another question about our friends and the Karen Alliance. So there have been a number of announcements related to EHNAC and the Karen Alliance. Will the merged entity continue to pursue consumer-facing solutions such as telehealth and virtual care?
That's a great question, and absolutely we will. I think it's interesting when you look at the telehealth in particular. Telehealth today, I think that there are accreditations for telehealth organizations that are out there, but there are no accreditations at this point for telehealth platforms or technologies or standards, and there really aren't even solid standards in that space yet. So I think it's actually a really good and important question to be dealt with. I think that most folks are thinking that all they need to do is use their EHR and Zoom at the same time, and they're all done. It's like, I think that there's actually considerably more to be considered when you're doing that kind of work. So I do think that there's a potential for that. I think in the cross-sector space, we've learned at DirectTrust, as a part of our ANSI accredited standards development effort, we brought together a lot of folks from outside the healthcare community to talk about the kinds of secure information that they want to exchange, not just with healthcare entities, but frankly amongst themselves. So from a healthcare information exchange perspective and a cybersecurity standpoint, these organizations have their own challenges and different bars that they need to meet. They're outside the HIPAA boundaries, and so there's the Karen Alliance, I think, has a really good focus on this, on those sectors that are outside that HIPAA boundary. So it's absolutely essential that we think about this very, very thoughtfully, if that's a good way to describe it. I think we want to do this right, and I think being able to collaborate with, as we have, with the Karen Alliance and between EHNAC and DirectTrust ongoing. I mean, we've been doing this conversation about how credentials for consumers would work. We've been talking to EHNAC about that for EHNAC and Karen about that for over almost 2 years in collaboration with other industry players, including Cantera. So I think that's a very important discussion, and we will continue it for sure. Lee, any thoughts?
So I would just add this. We have on the consumer side, we absolutely want to continue to focus there, and we're not only working with Karen, but with there are a number of organizations as well that are working on this whole consumer piece. It is a very significant issue with consumers, and to assure consumers around the privacy and security of APIs going forward, and as they're looking to use various healthcare apps, that's a very important aspect that we're looking at and very concerned about as well, and helping consumers to feel a lot more confident in the apps that they are going to be using. So there's that piece. On the telehealth side, as Scott indicated, we in fact, from an EHNAC perspective, have been discussing telehealth with a number of organizations, I would say over the past year and a half, especially since telehealth became front and center during the pandemic. And in fact, so and as Scott indicated, there are a number of organizations that have created different aspects of what I would call protocols and other areas in telehealth. And there are some, I would say, processes to kind of provide some overview of telehealth, but not as Scott indicated, at the platform level. We think that that's an extremely important area, A. The second piece of that, which is really critical, is the aspect of privacy and security of those platforms. As patients and more and more people have access and are utilizing telehealth, the issue is bad actors are looking at telehealth as another quote risk vector to be able to infiltrate to get at patient information. So there's an increased risk, certainly, that's there. And so we feel that there's a very important aspect around assuring the level of privacy and security and rigor in some of these platforms going forward by a third-party review. So I would tell you that certainly telehealth, what we're doing with Karen as well, on the consumer side, will certainly be continuing, and we'll look to probably expand that out to collaborate with other organizations as well as we look at these initiatives going forward.
Great. And just to continue this theme of cross-stakeholder, cross-modality, cross-standards communication. So we have a question about TEFCA. Obviously, TEFCA has been a hot topic, and a lot of the interoperability conversation centers around TEFCA. But as I understand your comments today, you'll continue to support interoperability in and outside of TEFCA. Is that correct?
Yeah, absolutely. And so those of you who know us from a direct secure messaging standpoint understand that TEFCA does not include direct secure messaging, and that frankly, many of the QHINs are, while they're obligated to do QHIN to QHIN messaging, that is push messaging, there does not seem to be a lot of focus on that. And I think we believe that is mostly because folks believe direct secure messaging remains quite broadly adopted and quite effective for the purposes of push messaging. So I think that will likely remain outside of TEFCA, although it's possible at some point it could be a part of it. Likewise, there's also exchanges that happen outside of TEFCA anyway, like the information exchanges that patients expect through apps of their own choosing are not mandated by TEFCA, because as Lee was saying, TEFCA is actually not an obligation at this point, but are obligated under the information blocking rule. So people who want access to their records with an app of their choosing are going to be using those apps and getting access to their records, whether they're using TEFCA or not. And so there will be, IAS services. That's the the individual access services as provided under TEFCA but there will also be access to records that occur, frankly, entirely outside of the TEFCA realm. So how does that work? And so that, I think that's an important element. There are portal connections that are made to get access to to patient records. There's also information exchange that's happening outside of TEFCA in a bunch of other contexts as well. Lee, do you have other ideas about this? I think this is definitely, TEFCA is not the only game in town when it comes to health information exchange.
And I guess that's where I was going, is that, when you look at interoperability has several what I would call foundational pillars that are part of it. And certainly TEFCA is a component, is one of those, but you look at FHIR as well, and the actual exchange and how that, in the roadmap that was initially put out in January on TEFCA on how the QHINs will be leveraging it. And I think it's, there's been a lot of conversation over the past several months about revising that roadmap to be more user-friendly in adopting FHIR going forward. And I do think that there's been a lot of great work that's gone on there, such that I see FHIR being a very important part of that data exchange between QHINs going forward. And then you start to look at, FHIR overall with APIs is extremely critical to, again, with all these, getting as many of these APIs going through some level of hopefully an accreditation. We think the TD-RAP program that I mentioned is a very significant aspect of that for the industry, especially for third-party app developers and others. Certainly Karen and what we're doing with Karen on the consumer side with third-party app developers as well, provides a level of trust, stakeholder trust, that is, we think, critical for industry adoption and for whether it's consumers or all, other stakeholders, providers, payers, and others, to really feel confident in all of these APIs that are being promulgated. So it's very broad. When you start to look at interoperability, I think that ONC's done a good job in putting together an overall roadmap, but there are several foundational pillars for interoperability, implementation, and promulgation that are taking place, that are all working together, and that we're part of, and we want to be part of, as many of you are as well, in helping to actually make that a reality. So that's my additional thoughts, Scott, on the whole aspect, but very good question.
Thank you. And this is the last question that I have. So I'll say this is a final call. If you have any additional questions, feel free to use the question feature and go to webinar to send those questions over, and we can ask them of Scott and Lee in the time remaining. So the final question is really more about a reiteration and clarification around the EHNAC name and understanding just more about the merger. So as I understand it, the EHNAC name will continue and represent accreditation matters of DirectTrust. Can you clarify if this is correct?
Yeah, that's true. So the EHNAC name does remain in use, and it will remain in use basically to describe the commission. That is really the accreditation body that will manage all accreditation matters for DirectTrust. So yes, that's exactly right. Now, from a branding standpoint, we're also going to be very, very slow and intentional about how we change anything relative to brand. So because people know EHNAC and we don't want to upset any aspect of that, using the name as the brand for a period is certainly a part of what we're going to do as well. But it is nonetheless all under the DirectTrust auspices. So so EHNAC, the best way to think of this is EHNAC is the DirectTrust body that is associated with all of our accreditation matters and activities, and that's exactly the way to think about it. So the question asker had it just right.
You know what, Scott? One thing that the audience may be wondering as well, and is kind of the fact that we're merging together, et cetera. People may want to know, well, hey, what role is Scott Stewie, Lee Barrett going to be playing in this going forward? Maybe you want to talk about just briefly the roles that I'll be taking on as well, so that at least people who may know me, may know you, at least know what that's going to look like as well.
That's a great question, Lee, and a great thing to point out that folks may not have real clarity about this. So Lee Barrett and Deborah Hopkinson will remain as support for the commission, and Lee will continue to lead the commission into the future, at least for the next 2 years, if not beyond. And so that is our expectation. So Lee will be the commission chair and will play that role and continue to support the activities, the accreditation activities that he's supported. In addition, the relationships that Lee maintains, he will continue to maintain, which is important to us because, frankly, Lee brings relationships that I don't have. I bring relationships that Lee doesn't have. We have very different backgrounds. Lee kind of came up in the trust management realm, like really from the very beginning, like with a history and in both the payer and the insurance space. And I came up really kind of in the health information exchange and information technology space. So our two sets of relationships, I think, are in combination very exciting and useful to us. And so we don't intend to, for instance, Lee serves on the Sequoia board of directors. He will continue to do that. He also participates with EHI and with WEDI and with lots of other organizations like that. And his participation there will not change as far as we're concerned. We're excited to have him, carry wear his DirectTrust hat into those spaces because we're extremely excited about what he brings to this discussion. Likewise, Deborah, who has been, the contact right along, will continue to support the commission. And so those things can, and I remain the president and CEO of the combined organization. So that's the way this is going to work. Really, if you work with somebody inside either EHNAC or DirectTrust, there's probably no one you're going to miss because no one's really leaving as far as I know of yet. None of the assessors have an intention to leave that we've heard. We've met with all of the assessors from the EHNAC side, collectively, and I'm going through and meeting with each one of them individually. Likewise, no one on the DirectTrust side that you may have worked with is changing either. So really, pretty much everybody is in place. So a few folks will change their roles and their scope of involvement, but everyone will remain. So that's the thing to know, is that we're looking to make changes as slowly and as deliberately and as intentionally as we can. We will make changes, but we're going to make them, try and make them in a way that neither organization has much notice except to say, gee, that's a better idea, or what an improvement that is. So that's our goal. But I have no doubt that we'll make some mistakes, but I hope that none of them will be glaring as far as any of you are concerned.
Great. Well, Lee, Scott, thank you both. Scott, if you want to take us to the next slide, I think we have some general contact information on this slide. So if we didn't answer your questions today, as Scott mentioned previously, that short link of bit.ly/all capitals DTEHNAC is your best way to have your frequently asked questions answered. But you can also reach out to us at admin@directtrust.org. We have a couple of specific questions that came through at the very end, and Scott and Lee will pass those off to you for you to address individually with those people. Also, we just want to make sure that you're following us on LinkedIn for the latest news and information. So if you're not already doing that, please go out to the DirectTrust page and follow us there. We will put this information session up on that merger information page at that short link, and we will distribute the recording out to all of you today. So thank you all for attending. Thank you, Scott and Lee. And I think I can speak for all of us that we are really looking forward to 2023 as one organization. Any final thoughts from the two of you?
I think that's good. And thanks so much for all of you who made the time to attend today. And we look forward to working with you in the new year.
I would say as well, thank you to all of you. Happy holidays. And we look forward to a very exciting 2023 and continuing work with many of you. So thanks very much.
And happy holidays. Thanks.